Good morning, everyone, and thank you for joining this webinar. I'm Anne Livingston. I'm the chair of the Community Care Smart Assistive Technology Collaborative. The focus of today's webinar is extremely relevant in the times of the moment, catalysing the new normal of technology-enabled aged care services. Our webinar today is facilitated by Global Community Resourcing for the Community Care Smart Assistive Technology Collaborative. The collaborative has been operating since 2015 and has over 2,000 collaborators and a range of projects, both research and deployment projects in action. We've got collaborators from around the world and from every state and territory in Australia. Just a reminder that if you haven't formally registered at the collaborative site, it is accessible to all and free to register. The email address is, the site address is on the screen in front of you. For today's webinar, like every webinar, it's important that I emphasise that neither Global Community Resourcing or the Community Care Smart Assistive Technology Collaborative is endorsing, promoting any particular product, research entity or organisation. Rather, the purpose of our webinars is to serve to inform viewers of various technology and associated innovation currently either in deployment or in development or in research. Today's webinar is live, so it's your opportunity also to be actively involved in today's session. So use the chat pane to ask questions that you have. The chat pane's on the right of your screen. If you have any further questions or want to contact the collaborative research team directly, you can do that via sat@communityresourcing.com.au. Across the country, aged and community care providers are finding new ways to ensure continuity of care. It's an extremely difficult, challenging, but a time that's also providing great opportunities for enhanced digital service provision. And digital services are playing a critical role in the sector's response during this COVID-19 time. In just 3 months, older Australians have become more accustomed to tech-enabled aged and community services, and the new technologies have been embedded in most teams and most providers throughout the country. In this webinar, it's really intended for community care providers who are delivering services under the Commonwealth Home Support Programme, the Home Care Package Program and Short-Term Restorative Care Program. And particularly, it will focus on giving participants some guidance on utilising unspent CHSP funds in order to offer technology-based service alternatives, as well as some insights into how technology adoption may change the nature of service delivery over the next 5 years. In this webinar, Jahnke, the CEO of Umps Health, will discuss how community care providers have been using new technologies to support people better during service delivery as normal, but also during the time of COVID-19. He will also speak about the implications of technology adoption on the future of aged and community care services and the establishment of the next normal for our sector. Welcome to the Community Care Smart Assistive Technology Collaborative, Adam. Looking forward to your presentation today. Welcome.
Thanks, Anne. Hi, everybody. It's great to be here. My name is Adam, and I'm the CEO of Umps Health, as it says up there on that slide there. I'd like to start by acknowledging the Boonwurrung people. They're the traditional owners of the land that I live on in Melbourne, and so I pay my respects to their elders, past, present and emerging. And I also want to acknowledge any Indigenous people that might be on the call today, as well as the traditional owners of all of the countries that you're dialing in from. Today marks the commencement of National Reconciliation Week. And so I also want to acknowledge that there's still a gap that exists between Indigenous and non-Indigenous Australians. And that's really visible to those of us that work in aged care. Indigenous people can access aged care services 10 years earlier than non-Indigenous people. And that's reflective of the gap in life expectancy that still prevails today. It's the responsibility of all of us to continue to push for change and to close that gap. As some of you on the call will be aware, I didn't start Umps with the intention of creating a technology that's offered to people by aged care providers. It started out as a tool, as a system that we built to support my grandpa. In 2016, he had his first major fall. He was living independently in his own home, and he'd been there for 4 years since my grandma passed away, living on his own. He was getting some low-level support through the CHSP. That was primarily for meals though, because he'd never really cooked in his life. When he had that fall, we were fortunate in a way because it happened while he was putting the bins out. He lives on a main road, and people driving past saw him. They called an ambulance and got him the help that he needed. And we were doubly fortunate because when he got to hospital, we found out that his fall didn't result in any major breaks or major injuries, but he still needed to undergo several weeks of physical rehab because he was having trouble with balance. When he got back home, we were surprised at how much frailer he was compared to when he went into hospital. And that was even despite the weeks of physical rehab that he'd undergone. He was adamant that he wanted to stay living in that house. It was the place he'd been in for more than 60 years. It was the place he raised my mum in. It was the place that all of his grandchildren were really familiar with. There was a lot of social connection and a lot of independence tied up in that house. And that's really what we as his family wanted to support. So we stepped up the level of care that we were giving to him. We started visiting him before work and after work and calling him during the day. But we found that because we couldn't be there, we missed some key signs that his health was declining, and he fell again. He went into hospital again. And when he came out, he was frailer still. And that's something that when I talk about it, it's familiar to a lot of people who are informal carers, caring for an older relative. And it's definitely familiar to those of us that work and to support older people living in their own home, to community care providers. My background is in public health and technology. So my default was to look at what technologies were available to support him. I found out that he already had the industry standard in incident detection, like a pendant worn around the neck, and when something goes wrong, you press it. The problem with that, as we saw it, is that we only find out about something after it happens. And the kicker was that on both of those occasions when my grandpa fell, he wasn't wearing his pendant anyway. So we set out to build something new, something that would work for him, something really non-intrusive, something that was easy for him to understand. And really importantly, something that didn't ask him to change the way that he lived his life, that just worked in the background. He was the first person to use it. We all call him Umps, and so that's where the name Umps Health comes from. I'm just going to briefly explain to you what we do because I mention it several times throughout the webinar, but the majority of the technology I'll be talking about today is other organisations' technology. I've got my video up here, so I thought it's just easiest if I show you a system. This is how it arrives to clients, to consumers. The system uses smart plugs like this to measure people's interaction with everyday home appliances, like when they boil the kettle, use the toaster, open and shut the fridge, cook using a microwave. And then over a period of what's now 7 days, our system builds up a picture of a person's unique habits and behaviour. And then after that learning period, it raises alerts when changes in activity indicate declines in health and well-being. So things like when appliances aren't being used and they usually would be. So if someone normally gets up in the morning, boils the kettle, opens the fridge, gets the milk out to make a cup of coffee, and nothing happens, then an alert's raised. But also more subtle things. So, for example, if the fridge is opened less and less over a period of 3 days, 7 days, it's an indication that someone's appetite is changing. So it gives us the ability to raise these alerts, to send those to family members, other informal carers, friends, as well as care providers, so we can enable a more proactive intervention to keep people living independently at home. So my grandpa was the inspiration behind the system here. He was also a really technology savvy person, particularly given his age. The first ever computer that I used was in the home of my grandpa. He taught me how to play Pac-Man and Pong, and what a 3.5-inch floppy disk was, and that was subsequent to a 5.25-inch floppy disk. And he had all of this knowledge and all of this technology in his home well before we had a computer in our home. He was also one of the first people I knew to get the internet. And every year he'd spend hours on the computer making each of his grandkids these really detailed, intricate cards, using software that's kind of like Photoshop to put our heads on different bodies of animals and strong men and things like that. I know now that he's the exception to the rule, that his interest and engagement in technology isn't shared by the majority of people in their 90s or even in their 80s. I'm just going to share my screen now. Okay. Because the fact is that before COVID, BC, as some people are calling it, we accepted the fact that the people we support, older Australians, were digitally excluded. And this concept of digital exclusion, it's not something that's abstract. It has a really clear definition. And in Australia, it's measured annually through Australia's National Digital Inclusion Index. The Digital Inclusion Index is prepared by Telstra, RMIT, Swinburne, and Roy Morgan. Each year, a survey is conducted with a representative group of Australians. The survey measures digital inclusion across 3 dimensions. There's access, affordability, and digital ability. The output of these dimensions is then aggregated up into a single index, a single number, and that can be used to assess the level of digital inclusion in Australia. But as well, it shows the levels of digital inclusion between different cohorts. The report spells out the fact that it spells out levels of digital inclusion by age, also by income, by employment status, and by education levels. It identifies a gap in digital inclusion that exists between Indigenous and non-Indigenous Australians, as well as those who have a disability and those who don't. Across all of these different cohorts, people over the age of 65 are among the most digitally excluded in Australia. Compared to the general population, the survey reveals that older people on average have poorer access to the internet, smaller data allowances on smart devices. They've got to spend a higher proportion of their income to get connected, and they derive fewer benefits once they are online. What does that look like? It means that they don't access the benefits of mobile banking like we do. It means they don't connect over video with friends and family like we do. It means they don't jump on Google when they've got a question that needs to be answered like my stepsons do. They pay higher prices for taxis and hotels and flights. And they're excluded from things like Uber Eats and Deliveroo. Unfortunately, this digital divide is persistent. On this slide here, I've plotted the Digital Inclusion Index for all Australians in grey on this bar graph. Just jump in, George or Anne, if there's any issues with my screen share. I've got the Digital Inclusion Index here for all Australians. It's the grey bars on this graph. And then I've put the digital inclusion scores for people over 65 in orange. Now, we already knew, I told you that older people were digitally excluded, and it's probably something that you were all aware of before anyway. But what this graph shows is that the gap between older people and the rest of the population isn't closing. In fact, between 2014, the gap got wider. That line there, what I've called the digital divide, that is just the score for all of Australia minus the score for 65 plus. So it's the gap between the cohorts. In 2018, the E-Safety Commission released a report into the use of technology by older people. And that report provides some further context as to why older people aren't engaging online. The research showed that 6 out of 10 older people self-limit their learning when it comes to digital services to only tasks that they think are necessary. 1 in 3 people don't like experimenting with devices, and that's because they fear that they might need to ask for help, and that's embarrassing. Or they're worried that they might accidentally change settings on the device and they need help to set them right. And because people aren't using devices regularly, they're not developing the skills and the capacity to engage digitally. And 4 in 10 people forget how to use their devices because of irregular use. I've put a link to this report here. You can access it just by Googling understanding digital behaviours of older Australians. But it's a little bit frightening that the report considers people aged 50 to 79 years old. So these conclusions are probably understated when you think about the people that we support. The report was produced by the E-Safety Commission, and it blends quantitative and qualitative measures of research. And I think that's why it provides such interesting reading. It also shows that among older people, those who are digitally disengaged often fail to see any part of their life that the internet can enhance. And these are just some really fantastic quotes here. And I think it's great that this really official government report have chosen to represent the views of these digitally excluded people without any modification. So there's some really great context provided in this report, and it's excellent reading. So it's certainly our reality that before, in this pre-COVID world, we accepted that older people were digitally excluded. That divide had been measured for years. The divide had been growing, certainly not closing. And people were opting out of learning new skills because they didn't perceive them as useful. They didn't derive as much value as the rest of us did from going online. And I know that this isn't news to many of you, but I think it's still important that we look at the research that's out there, because so often when we talk about older people and technology, we can become biased by our own perceptions and stereotypes. And that's anyone. That's natural. But this was before COVID. And then in January in Australia, we had our first case of coronavirus confirmed. From there, we entered a state of response. And our response in Australia to COVID-19 was informed. We understood from other countries that the virus was really contagious. We knew that older people were particularly vulnerable to COVID-19. And because of this, we were proactive when we were considering the measures to protect people. As early as February, we started to hear stories of families only speaking to parents and grandparents through windows, limiting their face-to-face time spent with their loved ones to reduce the likelihood that they might carry and transmit the virus to them. Each day, we started to see the Chief Medical Officer and the Department of Health propose more measures to reduce the spread of coronavirus. A lot of those were targeted towards older people as well. Abroad, in places like the UK, we saw older people being asked to lock down. And the duration of time that they were speaking about over there was for potentially up to 16 weeks. Here in Australia in March, guidelines were released requesting aged care homes limit visits to only those deemed necessary, to operate with essential staff, and to ask family members to stay away if they can. That's something that affected my family. My grandpa was in palliative care at that time. We could only visit him in groups of 2, and when we did, we had to wear head-to-toe PPE, personal protective equipment. Very suddenly, the way that really everyone had to do things grounded to a halt, but that was doubly so for older people, for older Australians. It's now only May. We're not a long time gone. We still have some time to go until we come out the other side of coronavirus, but there's already evidence telling us that in the face of this disruption, in the face of isolation, older people have shifted a lot of their activities online. These are things like going to church and grocery shopping and seeing their kids and grandkids. These things have become virtual. And it's not incongruent with the conclusions around digital exclusion, because if most older people were only learning the skills they thought were necessary, and going online has now become necessary, it's natural that they'd look to develop these skills. In this presentation, I'm going to try and rely heavily on data, and as much as I can, I'm going to pull examples from the coalface. I'm going to try and pull examples from organisations that are working to support older people throughout the pandemic. Lively is a home care provider in Melbourne, and they employ younger people to help older people stay connected and to live well. As it became clear that COVID-19 would isolate a lot of older people, Lively launched a response package that offered free practical support to seniors. In March and April, more than 50% of the inquiries that Lively received were people directly requesting support with technology. These are things like getting online to connect with family and friends, tech support delivered over the phone, tech support delivered in someone's home, or even putting in place technology to keep themselves safe and well, like the technology that we provide. Villa Maria Catholic Homes, VMCH, is a provider that we work with in Victoria. They work across residential and community care, and they also work in disability. In early March, VMCH identified that their most vulnerable clients had reduced face-to-face contact with family and friends. They were also cancelling home care services. And that fact around people cancelling home services is something that was experienced sector-wide. I saw an article recently where Australian Unity commented that 20% of home care clients had cancelled services as well. In response to this, case managers at VMCH identified 100 of their most vulnerable clients on home care packages. And then over 3 days, they called every one of those clients and offered them the Umps Smart Home as part of their home care package. It was surprising how many of those that decided to take up Umps. It surprised me. It was nearly 40% of those chose to put Umps in place immediately over the phone without even seeing the system, with sort of less insight into it than what I've given to you in this call. That's a big uptake rate. And another third showed interest but wanted a physical brochure sent out so they could discuss it with their family. And this increased uptake rate of technology is something that we've seen across the board as well. We're working with another provider in Victoria, Jahnke. They also provide community care. They also deliver services under the NDIS. After the extended flexible funding provisions were announced, Jahnke established a team to look at the potential use of tech-based service alternatives that might better meet the needs of their clients throughout coronavirus. After initial discussions with clients, it became really clear to the team that the biggest issue that clients were facing was social isolation. So Jahnke collated a list of nearly 350 eligible clients that could receive services under these flexible funding provisions. And to date, they've contacted 200 of them, offering a suite of technology-enabled services. Now, the most commonly taken up piece of technology was the Lumen tablet. So Lumen is a simplified tablet that's been designed specifically for older people. It allows them to stay connected with family, friends, and carers through video or text or phone calls, and all of these can be activated with a single touch. It's really big. It's sort of like 17 inches. It's got lots of other applications like medication reminders, news services, and entertainment. And importantly, it just arrives set up and ready to go out of the box. So people don't have to be familiar with tablet technology to be able to get going. As of yesterday, I spoke to Gen U and they've contacted 200 clients out of that list of 350. 60% of those clients have chosen to take up a technology offering, and 80% of those that have taken it up have taken up the Lumen tablet. And that's reflective of the fact that people want to stay connected, and people are happy to now move that online because it's become necessary. And so it's clear now that right now that the costs of not adopting technology are really high. And again, that's for everyone. If we weren't running this session over a webinar, we just couldn't do it. We can't meet in those numbers. We can't even travel between every state at the moment. We know that in response to the costs of not adopting technology, that older people are now requesting more support to get online. That's from providers and that's from family members. And the uptake rate of technology has increased a lot. In March, Channel 7 ran a news story on Umps. And after we get any form of PR or sort of exposure on mass media, the vast majority of people that normally contact us are adult children looking to put Umps in place for an older relative. But after that story ran, for the first time, our phones were just inundated with older people looking to put Umps in place for themselves. As restrictions in some states are eased, older people are going to continue to experience the convenience and the connection, as well as the cost savings that are offered by technology. These are just services that no one gives up. They've got a value beyond a response to COVID-19, and people now know that they can receive these services from their aged care provider. So in our next normal, these sustained benefits mean that it's possible people won't just accept technology. We won't just be pushing it on to people. They'll begin to expect it. Under the mantra of consumer-directed care and increased choice, this is really good news for the realisation of a high-tech, high-touch industry. And that's what leaders in aged care have been working towards for years. But we'd be naive if we didn't recognise the flip side of the coin. The responsibility that our organisations have to guide consumers through these technology offerings and to provide them just alongside traditional aged care services. From as early as 2014, the Aged Care Industry Information Technology Council, they'd identified that there was a low level of technology readiness in Australia. In 2017, the council published the Aged Care Technology Roadmap, and that also identified that there was this issue that no centralised approach had been taken to preparing our workforce for the emergence of new technologies, that the capacity building activities were fragmented, and they were happening to varying degrees within different providers. This is something that in a pre-COVID world we'd also come to accept. That we operated with a workforce with a low level of technology literacy, and that our people, were barriers to the mainstream adoption of technology. But of course, COVID-19 has changed that too. Everyone in every company, in every sector, has been forced to use technology in new ways to get their jobs done. Prior to COVID-19, VMCH, that same provider I mentioned that offered Umps to their vulnerable home care clients, they'd already identified that many of their employees often work from multiple offices or spend the majority of time on the road between meeting clients. This made it difficult for them to attend face-to-face meetings. There was a lot of wasted time in commuting, and they'd identified that there was an opportunity for people to use video conferencing to undertake internal meetings. This was in 2019. It was sort of towards the middle of last year, well before COVID-19 was on our radar, but it was highly revolutionary, using video conferencing for remote work. And the business case is really clear. Staff can spend less time on the road, moving between offices. It allows them to work more flexibly. They can remain more connected with their co-workers. And when you've got staff on the road, sometimes they might only be in the office once a week, once every couple of weeks. So it allows them to remain engaged with the organisation. It looked like a win-win. VMCH already had an enterprise license for Microsoft Teams. Microsoft Teams is Microsoft's version of Zoom and Slack. It allows for video conferencing. It also allows for chat, sort of asynchronous chat. And importantly, staff already had this software installed on all of their work computers. So it didn't seem like it'd be difficult to get people up and running and to use video conferencing. The strategy and innovation team VMCH ran an employee engagement program over 6 months. They supported staff with training sessions by attending their team meetings, and they promoted the use of Microsoft Teams. And by March this year, after that engagement program, after more than 6 months, they had more than 100 staff using Microsoft Teams. So this graph here, you can see down the bottom there are dates. So that's February and March of 2020. Along the vertical axis, we've got the number of people using Teams on a daily basis. And so it clearly follows this peak and trough pattern, and that makes sense because we've got weekends and weekdays. This double trough here is when we had a Labor Day public holiday in Victoria. So you can see that people on Saturdays, they tend to access Teams a little bit more common than on Sundays. And then here was a public holiday on Monday, which it looks like everyone at VMCH took. And then throughout March and April, as the number of new cases in Victoria rose, VMCH, like lots of other organisations in aged care and in other sectors, mandated that all external meetings and all non-essential internal meetings should occur over video to reduce the likelihood that staff come into contact with a person carrying coronavirus. By May, the number of employees using video conference tools had grown by 5 times to more than 500 daily users. That's caseworkers, case managers, customer support teams, team leaders, right through to business support staff operating normally from head office, all communicating digitally where they weren't before. You can see that both during weekdays and on weekends, the number of people using Microsoft Teams has increased. This extra long trough here is Easter. So in an industry that's known for low levels of tech literacy, I think it's phenomenal to have so many people communicating and collaborating online. It would have been unheard of pre-COVID. So that is now a capacity that's been built within the organisation and exists. That's going to continue the ability for people to use video conferencing and to collaborate online post-COVID. And it's going to change the way that work's undertaken into the future. It means that VMCH now have the possibility to reduce the amount of travel that occurs between offices. They can support more flexible work arrangements. They can hire people based on the location of their clients rather than the location of physical offices. This capacity is going to help VMCH establish their next normal And it's enabled only because technology has been embedded into the way that every employee communicates. Some of you might have come across this next company, Move and Groove. They were at the AXA National Summit. They were also on Old People's Home for 4-year-olds, which aired on the ABC last year. The Move and Groove program uses silent disco technology to deliver a full lifestyle program. It includes music therapy and ebooks. It's delivered in residential care as well as community care. And because they use silent disco technology, it means that every person wearing one of those headsets can listen to something unique. And so the pieces of content that go through those headsets are tailored to people's interests, their cultures, and their music tastes. This technology is cheap too. It's around $250 for an annual subscription to the Move and Groove platform. And then there's another pretty affordable upfront cost for the headset itself. The system's been really successful when used as a therapy to manage dementia and dementia behaviours. And it provides a really unique way to engage with people who are isolated. And that could be people in residential care, or it could be people who are isolated in the community. Now, the great thing about Move and Groove is that it's been designed from the ground up to be delivered by care staff. There's no specialist skills required to implement this technology. It's really been designed to be delivered alongside traditional aged care services and social support programs. When a care provider signs up to Move and Groove, they receive a login to just a web-based portal, and they get all the training materials required to implement the system. The Move and Groove platform then becomes a tool that can be accessed 24/7 to better support clients. Uniting New South Wales had been trialling this technology at one of its residential aged care homes in New South Wales, and they'd had really positive results pre-COVID. They were using it to engage with residents that were particularly isolated, as well as people with dementia. And what they'd seen was that these people who were socially isolated were up and dancing, engaging with staff and communicating with one another once content started to be delivered over these headsets. On the 26th of March this year, one of Uniting's aged care homes in New South Wales begun restricting visitation. And that was in line with the guidelines issued by the Department of Health. To support people to remain connected with their loved ones, Move and Groove worked with Uniting to add video conferencing capabilities. This meant staff from Uniting could use the same system that they were using for silent discos to support virtual visits. And because staff had already built this capacity, built this capability to use the platform, there were virtually no overheads associated with rolling out the service. Importantly, Uniting have already stated publicly that they're planning to continue operating this technology and continue operating these virtual visits even after restrictions are eased, because they built this capacity to do so. And it's so needed in residential care. Anything that we can do to support visitation for older people, to support people to remain connected in a post-COVID world is important. The people living in residential care are among the most isolated in Australia. Over the past 3 months, Umps has provided training and resources to more than 300 employees of aged care providers. And so this training is designed to support them to deliver technology-based services alongside traditional aged care services. In these sessions, we focus on things far broader than just Umps. We focus on building the skills required to discuss technology with clients and introduce a suite of digital tools, of technologies that can be provided through home care packages and through the Commonwealth Home Support Programme. This is knowledge that has relevance in a post-COVID world. In our next normal, we need to be ensuring that all people, all of our staff, have this knowledge so they can use technology to improve the way that they work and to improve the lives of those they support. I've just stopped sharing my screen for a second. Today, as I've gone through these examples, I've tried to show you how providers are supporting consumers to use technology throughout COVID-19 and supporting consumers using technology. I spoke about us, about Umps. I spoke about Lively and their support for older people to use technology and remain connected. I spoke about GenU and their use of the Lumen tablet. I talked about Villa Maria Catholic homes and this massive uptick in the use of remote working software. We talked about Move and Groove and how Uniting are also using the technology to keep people connected in residential care facilities and run virtual visits. And that technology has applications in community care. I've chosen each of these examples because they provide some insight into how the attitudes and expectations of consumers of aged care might change in a post-COVID world. And that throughout the pandemic, these examples show that we're already building a capacity to offer technology. And we should continue to do so and use this capacity into the future. These are only two factors that could shape our next normal. There are many, many others, and these might be different depending on your organisation and depending on your clients. But what I really want to do is provoke a conversation about how we can affect system-wide change. We know that technology isn't a panacea, but it can play a role because it's an inconvenient truth that aged care in its prior state before COVID, it wasn't going to scale to meet the projected increases in demand for aged care services over the next decade. In April, the government's most recent home care package program data report was released. And that showed that 104,473 people are still waiting to receive a home care package at the level that they've been approved. So they're in that national prioritisation system. In 2018, 16,000 people died in that system and 13,000 entered residential care while on that wait list. And for those that did go into residential care, they've got about a 50-50 chance of entering a residential care facility that's operating at a loss, that's operating unsustainably. Stuart Brown's most recent aged care financial performance survey showed that 56% of aged care homes are operating at a loss. We also know that despite the Productivity Commission stating that we need to triple Australia's aged care workforce over the next 3 decades, the Aged Care Workforce Task Force report showed that our sector faces workforce shortages, with lots of advertised positions remaining vacant. We can't afford to revert to the way that we delivered care before COVID-19. And fortunately, we don't have to if we're conscious about the changes we want to make. In March, the Department of Health announced that it would extend flexible funding provisions for CHSP service providers. And this is a great first step. Providers can now reallocate up to 100% of their funds between services and across aged care planning regions. And this is enabling them to be more responsive to the needs of older people. It's also unlocking this war chest of unspent funds. Many providers are using this additional flexibility to put in place technology alternatives to services that are impacted by COVID-19. They've used the additional flexibility to purchase smart home technology and offer virtual respite. Other providers that have had to suspend social activities and one-on-one social support services have purchased tablets and smartphones and even internet subscriptions. And they're now facilitating group video calls to keep clients connected. The additional flexibility has improved the responsiveness of care providers throughout COVID-19. It's enabled them to use technology to support wellness and reablement. Ongoing flexibility will mean that they can continue to remain responsive and they don't need to wind back technology-enabled aged care as restrictions ease. And it's positive that these provisions have now been extended to include funding allocated to providers in 2020 and 2021. We're going to emerge from this disruption with the highest levels of technology utilisation in aged care ever. The crisis has driven our workforce to use technology in every aspect of their job, and moving forward, consumers will continue to seek out digital services that can keep them safe, well and connected. Most importantly, during this period, we've proven how quickly the sector and our system can adapt when we're relentlessly focused on one goal. Again, technology is not a panacea, but I believe that we can make decisions now to use some of the changes that I've mentioned to snap forward and establish the next normal in aged care services. That is it for my prepared content, but I'm really happy to take some questions now.
Thanks, Adam. Great presentation. Very thought-provoking of the times and of the challenges that service providers are facing and trying to deal with. I've got a number of questions that have come in both on the chat pane and into our collaboratives office. So the first one comes from Denise. And Denise is asking, have there been any consideration for people with disabilities in the rollout? Do you want to make some comments about that?
Yeah, so we, like at Umps, we do support people with disabilities. And when we think about from a functional perspective, I mean, people with disability is such a diverse range of people. So the functional ability of people with disabilities is very diverse. It's hard to sort of paint people with the same brush. But from a functional perspective, there are people with disabilities who have restricted mobility. There are people with disabilities who have sensory impairments. They're similar impairments that people can experience in older age. And so a lot of the technologies that I've mentioned today also have applicability in disability. A lot of the providers that we work with also deliver services under the NDIS. I'm aware that there have been some announcements made by the NDIA to support people with technology in response to COVID-19. We're working primarily with aged care providers at the moment, so I can't speak any further to the specifics from a policy perspective. So sorry, it's not a more in-depth answer, but yeah.
Thanks, Adam. I've got a question here from Dr. Kate Barnett. Kate asks, is the gap between older and younger Australians on the digital literacy scale reduced with the younger old, e.g. the 65 to 75? And is the divide really about people aged, say, 85 and over?
Yeah, so I think this is a problem with the way that a lot of research is structured. We have this tendency to group all people over 65 in the one cohort. But a lot of the research suggests that we should be thinking about older age as not just the third age, but also the fourth age. The third age being that time post-retirement when you're very active still, you don't have a lot of impairments, you may actually increase your level of engagement socially, you may actually travel more. And then the fourth age where impairments start to restrict your ability to engage in those activities. The specific research in the Digital Inclusion Index just looks at people over the age of 65 and doesn't break it down into those cohorts, unfortunately. The research from the eSafety Commission does. It does look at those aged 50 to 60, I believe, and then 61 to 79. And certainly the people aged 61 to 79 are far more disengaged than those younger old people. So the research does suggest that where it is, but your question points more broadly to a problem with the methodology around how we define older people when we undertake research too.
Thanks, Adam. I've got a great comment here from Ben. Ben says, Adam, I love your story and your drive.
Thanks,
have you looked or considered the called community and technology adoption?
Yeah, we have. We have. So when we started, I'll speak from UMPS's perspective. When we started developing our technology, we were very committed to this process of co-design. Um, Initially, that was a project where, it started out working with my grandpa to build a system that would work for him. And then once we realized that the technology had applications more broadly, we partnered with a provider in Victoria, Umps Health, to get the system into the hands of their clients and work with them over 18 months to build something that would just work for them. We were really conscious that after the first kind of 15 people in our reference group were kind of secured and using the system, that we had one type of people. They were people that were relatively affluent. They were nearly all white, and they had strong family support networks. So we became conscious about recruiting more diversity within our reference group. And one example is we kind of had the first time we had a woman who was born in China, then lives here. Her family were here supporting her, went to use the system, and she plugged a plug into her rice cooker. And the rice cooker isn't used like regular appliances. It's something you get out of the drawer, you plug it in, you turn it on, you use it, and then most people pack it away again. The plugs that we were using at the time had this annoying quirk where when you plugged it in, the plug had to hook up to the network before it would switch on and allow power to run through it. And so the plug would plug in, and it took like 30, 40 seconds at its longest for power to be available to the rice cooker. And that meant this woman was trying to use the rice cooker. It wasn't working. She was like, well, this is ridiculous. So she just discarded the plug and threw it away, thought it wasn't working. That's an insight that we wouldn't have had unless we tried to recruit more diversity within our reference group. And if we didn't do that very early on in the development of our technology, then it's something that we could have missed, and we could have built something, and we could have further exacerbated the digital divide that exists between those of us that really speak English and sort of are white, and culturally and linguistically diverse communities. I hope that's just one example of how the concept of co-design can ensure that you develop an inclusive product.
Thanks, Adam. We've got a couple of questions around affordability of these new technologies, particularly those as smart home technologies. I guess those questions are also alluding to how service providers might cost them into their unit costs for service delivery.
Yeah. This is tricky, and this is changing the second part of that question around how providers cost things into service delivery. That's changing at the moment. With regards to, I'll start with affordability. Technology offers the potential for us to deliver a more efficient service. The costs of technology are far less than traditional aged care services in many aspects. And we think that that's really well suited to kind of entry-level aged care services. So there are 1 million people on CHSP. The system sort of roughly has, a couple of $2 billion in funding. That means that for each participant in that, each person receiving services under that funding scheme, there's about $2,000 that can be spent on aged care services. It's not a lot of face-to-face contact. Whereas a lot of the technologies that I present, pretty much all of the technologies that I presented in sort of my webinar today can be delivered at cost lower than kind of face-to-face services. And maybe what that means is that we can be more targeted about where we do use people, because technology won't replace the delivery of care. Maybe it can deliver a component of it and support people to be more proactive and to use the skill sets that we have within our organisations more wisely. That's kind of from a funding perspective and a systems perspective. Then it comes like the commercial model that providers implement to get technology out there, that's a trickier question. Under sort of the home care package program, traditionally, providers sort of may charge an administration fee, could range between like 10% to sort of like 30%. And that's designed to cover overheads. But sort of as those have become public, now providers are looking at ways to reduce those administration fees because it's more competitive. It's very transparent. And so I think there are opportunities to work with technology providers to make technology a component that realizes revenue for the organization. One important thing I think that providers should keep in mind is that when delivering that service, value should be apportioned to each party, like revenue margin should be attributed to each party based on the value that they're delivering. So I don't think it's enough to necessarily say, look, we'll provide this technology and we want to take a 30% margin. I think that we can think about how technology is used. We can think about the ways that it can improve our service delivery. We can think about new services that we can deliver on top of new technology. And then we can think about how we monetize it. So the technology providers are being compensated for the provision of technology, and the providers are being compensated for their innovative use of technology and the service improvements. I hope that kind of gives some insight into the way that we're approaching it. But it is changing. It's changing quite quickly now, really.
Thanks, Adam. Can you talk a little bit about the Australian and international marketplace for these technologies?
Yeah, so we at the moment are just operating in Australia, and I think that the majority of the business, actually every business that I spoke about in this webinar, is an Australian company, and they all have established solutions that are in market, but they're all really responsive to the needs of providers. And I think that's important given the level of digital maturity that we have in aged care. We still need to be working collaboratively to develop the way that we enable technology through aged care in this country. But the market for technology is big. Like I mentioned, a lot of these are geared, are particularly well suited for people sort of at the entry level of aged care services. There are lots of people receiving entry levels for aged care services. So yeah, I think certainly there's a lot of opportunity for technology innovation and to scale innovation in Australia. When I think about the market, I think about like there's so many different aspects there, but maybe I'll just talk very briefly about the funding mechanisms, which I've touched on a bit. I think there is an opportunity for us to take a more centralised approach at a government level to change the way that the market in Australia is structured to promote innovation. Last year, the Department of Health released some CHSP innovation funding, and they ended up funding, I believe, 59 projects from this $25 million pool of funding. And those were implemented throughout Australia in sort of every state and territory. And we were involved in a couple of those. Our observation is that the providers that had accessed that funding were in a better position to roll out technology in response to COVID-19. What we've got sitting in that funding mechanism and sitting within that program is 59 projects that have been tested in the context of aged care providers. A lot of them are technology based, but there's no follow-on funding that's been announced for that. There isn't yet a mechanism to scale those projects through the CHSP and through the home care package program. And so when I think of the structure of the market and how it relates to technology, I think having an innovation fund where we can fund innovations across the country and maybe only have an expectation that 15 or 20% of those projects will be successful, but then from a structure perspective, have the ability to pull through those projects and scale those up within the existing aged care market and structure. I think that's something that sort of I see as a really desirable future state. I'm conscious of time, so I might just leave
Thanks,
that answer
Adam.
there.
And yes, we need to stop the question and answers at this point. We've got a range of questions that we weren't able to get to. We will be following up those questions with the participants of today's session, but we'll also be posting Adam's presentation again on the Community Care Smart Assistive Technology Collaborative. So again, if you haven't registered, please register, and then you'll get access to view this or share this video with others. We'll also post, we've had several requests for the Australian Digital Index and the E-Safety Commission report, and we've posted those in the past on our website, and we'll put those in a top section. So look, thank you, Adam. Really thought-provoking presentation today, very timely in the context that we're all dealing with the new normal and trying to vision what the horizon might look like for us post-COVID. Thank you very much for taking the time today, and on behalf of everyone participating in today's session, thank you for your contribution.
No problem, Anne. And if anyone has any further questions specifically, we'll distribute those resources, and I'm happy to share our contact details as well. So I've just put those up on the screen. You can just email that number. Or email that email there, or call that number, and then I'll respond back from my personal email.
Thank you. And finally, in closing today's session, in Adam's presentation, thank you. You mentioned the work of the Australian Aged Care Industry Technology Council. We're very proud to be involved in the work of the council, and Dr. George Mangelis was in attendance today. But the council is currently undertaking a large national survey, and I'd like to encourage all participants from today's webinar to undertake the surveys. There's actually 2 surveys in a research project that the council is undertaking called Capabilities in Aged and Community Care Readiness, an evaluation of innovation and technology. This research project we're commonly calling Care IT Research Project, and is being led by the Australian Aged Care Industry Technology Council in pursuit of benchmarking, I guess, where the sector is now and some of the key considerations for the future. Importantly, we know that the report will be able to guide governments when they're thinking about investment in innovation and technology, and some of the strategies that Adam alluded to are certainly some of the issues that are coming through with the surveys. So there are 2 surveys, an industry survey and a vendor survey. We're trying to get perspectives from both quarters, so that more information is available on the council's website, and I'd encourage you to go to the website that's on your screen now at www.aciitc.com.au, and if you've got any particular questions on the survey, to email secretariat@aciitc.com.au. This is a really important landmark study, the first opportunity to get a national perspective and to scan internationally and nationally the evidence around using technologies such as smart home technologies, but also business to government links, technologies that broadly support people in their own homes. So I'd encourage you to be involved in that. So to conclude today's webinar, just to remind everyone to register if you're not already registered, and you'll get our updates on upcoming webinars. We're hoping to feature some current research in the next couple of weeks, specifically around the uptake of smart home technology and what works and what doesn't. But get in touch with us at sat@communityresourcing.com.au. Thank you everyone for attending today's webinar, and thank you particularly Adam for your presentation today, and Georgie and the team who behind the scenes have been operating and putting together today's session. Thank you.
Thanks.